Good evening, everybody. I am Dr. Mohit Bandari. I am a bariatric, metabolic, and robotic weight loss surgeon, and we are proudly associated with the Medicover group of hospitals. Today, I am going to discuss about bariatric metabolic surgery and non-surgical weight loss options. At the Medicover group of hospitals, we perform both surgical and non-surgical weight loss options. Let's first discuss who are the candidates for surgery, which is bariatric and metabolic surgery. Candidates with a body mass index of 32.5 or more with one of the comorbidities like type 2 diabetes, hypertension, sleep apnea, or lipid disorders are good candidates for bariatric metabolic surgery. Candidates with a body mass index of 35 or more without these comorbidities are also very good candidates for bariatric metabolic surgery. In Asia Pacific region, we have specifically more diabetes. And not only that, our diabetes, which is the type 2 diabetes, come at a very less body mass index, and the studies suggest that as Indians or as Asians, we get peak of our diabetes at a BMI of around 28. So, as per the Asia Pacific norms suggested by the International Federation for Surgical Obesity and endorsed by the American Diabetes Association, it makes sense to operate upon individuals just for their type 2 diabetes, for their stoppage of their medications or insulin, and control of their type 2 diabetes if they are refractory to all medical management, even at a BMI of 27.5. And here we are talking about treatment of just type 2 diabetes by surgery, which is called as metabolic or diabetes surgery. We perform all these procedures at the Medicover group of hospitals. Now let us talk about the non-surgical weight loss options. We are the only group performing the non-surgical weight loss options, which includes the endoscopic sleeve gastroplasty and the swallow balloon at the Medicover group of hospitals. The endoscopic sleeve gastroplasty is performed for individuals who have a BMI of less than 32.5, but they still intend to have some weight loss. These are the individuals who still have some comorbidities, but their weight is not as high to become eligible for the bariatric surgery. The endoscopic sleeve gastroplasty is a procedure where we can discharge the patient in the evening or next day in the morning. It is a non-surgical weight loss method done completely by endoscopy, where a scope goes in through the mouth and then we take sutures inside the stomach to reduce the capacity of the stomach. There is no cutting involved in this procedure. There is no burning involved in this procedure. There is no stapling involved in this procedure. It is just insertion of endoscope through the mouth and taking certain sutures to reduce the capacity of the stomach. Similarly, those patients who do not want even to stay in a hospital for overnight, do not want endoscopy, do not want surgery, and do not want even the anesthesia, now we have, for the first time in the country, something called as a swallow pill or a swallow balloon, which we are regularly doing at the Medicover group of hospital. A swallow balloon is a procedure where in fact it's a non-procedural balloon where we ask the patient to swallow a vegan capsule or a vegan pill which goes inside the stomach. The vegan pill is attached to a very thin catheter, which is then filled by a proprietary fluid of 500 ml, and the pill converts into the balloon inside the stomach, and then that catheter is detached and the patient can be sent home. This particular balloon deflates itself after 4 to 6 months and passes through the motion. This procedure gives the patient 10 to 15% of total weight loss. In some patients, it is noted that it gives 15 to 20% of total weight loss. This is a completely non-procedural balloon which does not require an endoscopy to put it in and also does not require an endoscopy to remove out. The patient can be sent home on an outpatient basis after the procedure, an hour or so after the procedure. So these are the procedures we perform at the Medicover group of hospitals. The results and the outcomes of the procedures. The bariatric metabolic surgery would give around 25 to 30% of total weight loss, in some cases even 35% of total weight loss, whereas the non-surgical weight loss options would give ranging from 15 to 25% of total weight loss. Both the procedures got good resolution of comorbidities like type 2 diabetes, hypertension, and sleep apnea. Most patients ask us what are the side effects or complications of these procedures. We usually recommend 6 months of multivitamins, proteins, and elemental substitutes for the patients, and if our patients are able to take these micronutrients and proteins in a good quantity which we suggest, they usually do not have nutritional complications. Very minimal complications in surgery, which is in the range of 0.001%, because our team taken together have performed more than 20,000 bariatric metabolic procedure, and thereby the surgical complications are very minimized due to a very standardized approach and technique towards bariatric metabolic surgery. At the end, I would say that Medicover Group of Hospital is not only a surgical program, but it's a team approach where we have a multidisciplinary team where not only the surgeon plays a key role, but there are a group of dietitians, physiotherapists, pulmonologists, psychologists to take care of you. So I wish to have you someday to consult me and then have you partner in your weight loss journey. Thank you so much.